Now. Hello, good evening, everybody. Good evening, and how are you? Welcome to another session of Ask the Doctors. On the program, this program tonight, we'll be talking about blood transfusion. Now, Ask the Doctors is a health program every Sunday, 8 p.m. West African time. We don't waste time here. My name is Dr. Frederick Unibohai, and my co-host is Dr. Israel. Today we have a guest joining us on the program to talk about blood transfusion. When we spoke about blood, I think that was 2 weeks ago. Yeah, people kept asking me so many questions, and I said, okay, let's have a specialist join us on the program to talk about blood transfusion. But before we go ahead, I want you to tell me, where are you watching me from? Please remember, on this program, we don't prescribe medications, we don't make diagnosis, we just teach. So tell me in the comment section, where are you watching me from? I see you. We have how many people here? I can see you. Welcome. Good evening, and how are you? Welcome. Tell me quickly, where are you watching me from? And my guest is already in the house. Glory. Glory, how are you? Glory, good evening. Oh yeah, share the live, share the live from Sierra Leone. Hey, hi. Hi, Sierra Leone. Yeah, let's go. Talk to me quickly. Um, Chief, sir, your camera is not on. Your camera is not on. Your camera is not on. Trying to bring you up. Okay. So we are streaming live on Facebook and YouTube. Please share this live session. Invite your friends. Invite them. Invite them. Let's see. Okay, from the UK. Let's see who is here. Mary. Mary from Sierra Leone. Okay. Who is here? Vivian from Cameroon. Helen from the UK. Evelyn on YouTube. Evelyn from Italy. Okay, nice. Now I want to bring up my guest. Before I bring him, let me tell you about him. So my guest is a hematologist. He's also a lecturer in the Department of Medicine, College of Medicine, University of Lagos, Nigeria. He's a blood health advocate, and he's the founder and the executive director of the White Cell Foundation. This is a non-governmental organization that was formed to raise awareness about blood cancer in Nigeria and also to provide support for patients and their families. Ladies and gentlemen, I think this will be the second time or the third time on the program. Yes. Please help me welcome Dr. Yusuf Adelabu. What happened? His network, he disappeared. Okay. Dr. Blessing, how far? Good evening. Good evening from Benin Republic. I see you. Helen, good evening. Okay, so let me bring up my guests. Uh, Chief, good evening, sir. Welcome to the program.
Yeah, good evening. Yeah, I hope you can hear me well now. I think for a while it
Yes,
appeared
yes, I can hear
network.
you
Okay.
loud and clear, sir. You're welcome to the program tonight. So, without wasting time, we have Dr. Israel already online. Dr. Israel is joining us too. Dr. Israel, good evening. How are you?
Good evening. Happy Sunday to everyone. Chief, happy Sunday.
Okay. So, let's talk briefly, sir. What is blood transfusion? Some people are listening to us. They're like, why would we be talking about blood? Because whenever they hear the word blood, there's this fear, aversion. Like, I beg, I don't want to hear about blood at all. So, why is blood transfusion, and why is it important that people need to know about blood transfusion?
Well, thank you, for that. So to start with, of course, we know blood is quite essential for life. So there won't be any life without blood, because actually every cell, every part of the body requires, um, to for it to function normally, to have oxygen. And what carries oxygen all around in all parts of our body, to several other it's about either receiving blood or donating blood. So We know blood donation save life, and blood transfusion also save life. So that for those in circumstances or situation whereby they require blood transfusion in order to save their life. Particularly to start with, a very common scenario is a pregnant woman that is during childbirth that is delivering and might have lost a lot of blood, or that may even already have low blood before going into labor. To save such a woman and the baby, a transfusion is required. Of course, if one has lost a lot of blood as a result of injury, whether being involved in a road traffic accident or any other form of blood loss, which can even be spontaneous from some condition, ability to be able to transfer or to replace the one that have been lost or that is not adequate in the body is a very important life-saving procedure or thing that can be done in such situations.
Thank you very much. So in road traffic accident cases, people need blood. Pregnant women, when they put to bed, sometimes they might need blood transfusion. I had a story of someone who had an accident and lost a lot of blood. Before they could take the person to the hospital, the person died just because of blood loss. But I've noticed that whenever this discussion is mentioned and we talk about people donating blood, they are scared. I don't know if you've experienced that, sir. I don't know why people are scared to donate blood. Um, why is that, and what can we do to encourage people to make themselves available for blood transfusion or
Oh,
blood
so that's
donation?
very good. For blood donation, that's a very good concern, Dr. Fred. I think in this part of the world, particularly in Africa, I think the fear there. People are afraid. A lot of people have this phobia for blood donation, and I think it has its underpinning in our cultural belief. We as Africans, we feel that when we're giving part of ourselves to other people, we actually have this cultural belief doesn't seem just right in terms of how it's being done in those instances. So, but I think a way to go around it, I think the mindset is changing. As generations come on, because there are lots of negative thoughts that we've had about having. Some people don't even want to give. Say, for example, they use clothing or anything, so they feel taking part of them to be given to some other person. Some find it so uncomfortable having to do that. But if we continue to change that mindset that not only is it blood donation is one of the situations whereby both the person that is donating the blood and person receive the both benefits. So if people begin to see the health benefits of blood donation, which there are so many of it. Of course, for the recipient of the blood, it saves the person's life, and we know how important it is to do that bit of the charity work to save one's life or save one person's life. But for oneself, there are a lot of health benefits, which I'm sure we'll still talk about. There are so many in which if people, I think one thing we need to do is the more we let people be aware of what the benefits are for even they themselves, the more we continue to change people's mindset and we'll begin to have more and more people donating. Because in other crimes, this is what people do, regularly. They love doing it. They do it, regularly and often. And that's part of what we are hoping to develop in this part of the world, because we still need a lot of people to voluntarily donate blood to save life.
Thank you, sir. You spoke about people donating voluntarily, and that is our greatest challenge right now, because the reports and that we had says that about 500,000 units of blood are donated annually in a nation that have about 200 million people. Just 500,000 units are being donated. I feel that people don't know the importance of blood donation. First of all, could you help us talk about, for me, I want to donate blood to somebody. What do I stand to gain? People say if you donate blood, you might collapse, so you will faint. Oh, I heard somebody donated blood and the person was rushed to the hospital. They gave the person back the blood. So what do I stand to gain if I donate blood for someone?
Okay, thank you very much. So the very first thing that the one actually benefits maximally is that one becomes even healthier. So donating blood regularly is one way for one to even improve one's health. Because it's been shown that if one donates blood regularly,
What happened?
Dr. Fred,
What happened to Dr. Yusuf? Okay, he's here now. Oh, him. Okay. Yes.
yeah, I
What?
guess the connectivity, the internet
Yes.
connection
Okay.
went up for it. So
Yeah.
I was
Welcome
saying
back.
that the very first benefit is the fact that it does help improve the health of the individual donating blood regularly. It's been shown to help improve the blood that flows in our body veins is produced in
I.
the bone marrow. So blood
Yeah.
donation helps to improve where I think, I'm not sure if it's from my end here. Um, can you confirm that
Yes.
you can still
Yes.
hear me
Yes.
well?
Okay. Yes. Now I can hear you. I can hear you, sir.
Okay, it's back. So I was making
Yeah.
my first point that
Yeah.
it improves the health generally because it makes the bone marrow, the blood in blood production. That's number one. Number two is also that because for each time you donate blood, you're going to check. It's also a way to have a comprehensive, health check that can be used abnormalities in the blood. We've had people that donate regularly, and because it also maintains their health, if anything was to go wrong, is detected early. Because standard need to donate blood, you have a blood pressure check, you have some screening tests done. You're going to also have a blood level check to see that it's adequate for you to be able to donate blood for it. So that's another advantage or another benefit for donating blood regularly. A third benefit is the impact in which it has when it comes to preventing some type of cancers in the body. Studies have shown that two organs that are involved in producing some hormones that the body needs to produce blood, they're even more efficient when one donates blood regularly. And those two organs are the liver and the kidneys. Mhm. We ensure that those that donate blood regularly have a lesser risk of having liver or blood or kidney cancer because these two organs become more efficient. Because the kidney, for example, produces an hormone called erythropoietin that helps the bone marrow to stimulate it to produce blood. So this process becomes super efficient, and the bone marrow becomes super efficient in producing blood. That it does reduce the risk of cancerous cells developing in the kidneys or in the liver. Another benefit for this is in terms of even maintenance of one's ideal body weight. Um, each time one donates blood, one loses some calories, about 600 kilocalories. It's been mentioned. So even it's recommended for those that even want to maintain their body weight or maybe they're obese or overweight and want to have an ideal body weight. Donating blood regularly is one of the several ways by which this can be achieved. So I can keep going on and on because there are so many benefits. But
Yeah.
one last one I'll just chip in before we go on to the next question is even the thyroid gland. So the thyroid gland, it's an organ around the neck region that produces an hormone that helps the body drive the process of generating energy, what we call metabolism. This organ too becomes more efficient, with regular blood donation. Some studies have shown. So virtually every part of the body is touched because if the blood becomes better, the bone marrow is more efficient. The health benefits are enormous, really, because such people are usually very healthy. And because even for you to donate blood, really, you would be healthy, and if you donate blood, you will even become more healthy. So the benefits
Hmm.
are really, really quite much. Yeah. So I encourage anyone to
Thank.
want to donate.
Thank you, sir. So donating blood has benefit for whoever is donating makes you more healthy. For those that are just coming, you are welcome. We're talking about blood transfusion tonight, and we have a guest, an expert, is answering all our questions. If you have any question on blood transfusion, please just relax. Don't worry, we'll take your questions. Help us share this video. Invite your friends. So I have one question. I don't know if they are together. How often can somebody donate? Let's say you are fine, you are healthy after all the whole checks. How often should you donate? And then what qualifies me for blood donation? How would I know? Somebody's even asking us a question right now and says a PCV of this and that, can he or she donate? So how often should I donate, and how would I know what are those criteria, or what are the list to check to know that this person is actually qualified for blood donation?
Okay, okay. I'll start with the second question about what qualifies one to be a blood donor. So there are a couple of criteria, and a lot of people fulfill this criteria, and that's why it's important to mention them so that you can assess yourself even before some other assessment is done. The very first thing is the age. Okay, you have to be an adult above 18 years. It's recommended that those that can donate blood should be between the ages of 18 and 65 years of age. However, for a first-time donor, if you have never donated before the age of 60, it's unlikely that your bone marrow, your blood will be efficient enough for you to donate blood. But if you have been donating before you're at the age of 60, you can still donate blood. So that is the very first thing, the age. The second thing, really, that must also be there is that one has to be of a particular minimum weight. So it's generally acceptable that if you are at least 45 kilograms, but to be more safer, if you are 50 kilograms, in the international 45 is still adequate, but just to be doubly sure and doubly safe, to be fit. And the reason for the weight is because the volume of blood in our body has a close link with our weight. So if one is of a lesser weight, if some amount of blood is it reduces the amount that the body can still cope with, and that's why that may not be. So you have to be at least 45 kilograms of weight, but more ideally 50 kilogram might even be. So that's the second thing to check. The third thing is now the level of the blood, because you can be of the ideal weight and age, but if you don't have enough blood yourself, you will not be able to give to others. So generally, the level of blood that is acceptable is the normal level, and that normal level is measured by what we call hemoglobin. Hemoglobin is the main constituent of the red cells that does the main function of the blood. There are several other things the blood do, for sure, but regarding the blood itself, so the hemoglobin level should be at least 12.5 grams per deciliter. And why this is so is, even according to the World Health Organization, anybody that has a blood level, hemoglobin level below this cutoff, this 12.5 grams per deciliter, is known to have what is referred to as anemia, that is shortage of blood or low blood level. So someone that's already short of blood cannot donate blood. So that level generally is, because particularly in females, males have slightly higher hemoglobin than females, but the cutoff for donation, and that hemoglobin of 12.5 grams per deciliter almost equates to about 38% of PCV, for it. So generally 38% above. The hemoglobin is more specific, is more reliable as the cutoff for transfusion, because we know the PCV can be affected by a number of things. So if the person hasn't taken enough water, if the person not taking enough water and there's now low PCV, PCV is like 30, it now appears higher than it should be normally. So that's the third thing. So the age, one has to be an adult, you have to be of ideal weight, you have to have adequate blood level. So many times when these three things are there, one can generally donate blood. But of course, there can now also be some medical conditions that may make one not to be able to donate blood. Say for example, if one has some organ failures, many a time most of these conditions come with low blood level. But a generally healthy adult, without any major health challenges, can donate blood. Now, in females, there are now some additional criteria that one can use to donate blood. Not that females cannot donate blood, but they also have some instances where they are not allowed to donate blood. One of it is in pregnancy, because even normally in pregnancy, the blood level goes down a little bit, but not so much. So a pregnant woman cannot donate blood because during that time period, it's going to affect the baby. A lactating or a breastfeeding mother too cannot donate blood for that time period in which she's breastfeeding. But afterwards, once the other criteria are fulfilled, she can donate blood. Now, a menstruated woman also too is not encouraged to donate blood at that point in time because the blood level is usually a bit lower then. Usually, it's advocated that a week after their menstrual flow has stopped, then they can donate blood if the other criteria, is fulfilled. And the reason for me bringing this up is because some people have the myth that women cannot donate blood generally, and that is a wrong notion. They can donate, but just that there are instances like I've mentioned in which they cannot donate blood. So those are the criteria that one has to fulfill to be able to donate blood. So to now address the second question about how often if one is eligible to donate and has donated the first time, how many times? So one can donate as a maximum of 3 to 4 times a year. So what that equates to is that every 3 months or every 4 months. Though in some other parts of the world, one can donate every 2 months. And even here, for some people, we do that, but we try to still keep it at 3 to 4 times a year. For those that would want to donate more regularly, and of course, the maximum frequency is every 2 months. And for such individuals, it's advocated that they should be taking some supplements that can help boost the blood. But if you donate 3 to 4 times a year, which is about 4 months, every 3 to 4 months, you won't need to take additional supplements to be able to continue doing that. Because even donating in your blood before the next one can replenish even much better because the bone marrow is more efficient in producing blood. So that's generally what we adhere to in this as a like a guideline in Nigeria. We rarely allow people to donate every 2 months. The earliest is every 3 months or 4 months, depending on the. But after that, you can donate more frequently than that. So those are the criteria, and also how frequently one can donate blood.
Thank you very much, sir. I just got a comment saying that your mic is not too clear. There's a sound coming from your mic. I don't know. Okay. So here you can donate 3 to 4 times in a year in Nigeria. I can see some questions already. Just please wait. We'll come to your questions very soon. There's this question I asked before on radio, and I want to ask again, sir. And the question is: people say they would not donate blood. That after donating the blood, the hospital would sell their blood. That why? Why would I donate my blood freely of my own volition, and then you take my blood, the hospital, and you sell my blood? For that reason, I'm not going to donate again. Please, sir, help us throw light on this. Is it true? Does it happen? And why do people have to pay again after donating blood for them?
Okay, so there are two aspects to this. On one side is the fact that, of course, um, some people just unfortunate, some people actually, take advantage of this, particularly in some settings, to exploit, people, to particularly in terms of selling blood in those instances. But generally, particularly in standard hospitals, government-run hospital and hospitals that are properly accredited, it is not allowable to sell blood. So on the other side is that even if you donate or when you donate your blood voluntarily, for that blood unit that you have donated, let's say 1 unit that you have donated, for it to be given to someone that needs it, there are a number of things that needs to be done on that blood unit. It's not going to be given directly, in that way. So the screening of the blood really is what usually the act or request from whoever is going to receive that blood to pay for, not the blood itself. Because really, if you are to put it, how much do you want to really put it to sell, blood per se, because it's almost you can't even almost pay for it because it's not something that you can manufacture. So if we are able to manufacture blood, people will not be requesting anyone to donate blood. So yes, in some And that's why it's advisable for one, if one wants to become a voluntary blood donor, to go to recognized centers, particularly government-run hospitals. Many of our general hospitals and also our tertiary hospitals, like the teaching hospitals, they have blood donor clinics or blood donor units, and they adhere to ethical and standard guidelines. And by that I mean that they don't sell blood in any way. The only thing that is done for the recipient is for them to pay for the screening, and this is even made even subsidized in this environment. And even in some government hospital, depending on the circumstance of the patient, whether it's needed urgently or whether it's also even is an indigent patient that needs it, at times it's even given freely. They waive the cost of the screening. So in a nutshell, I mean, to directly answer the question, what is usually paid for, which is the regular payment that those that receive the blood do, is paying for the screening, not for the blood that you have donated freely. The idea of donating blood is one that we will continue to encourage, because we know the benefits of it for both the donor and the recipient. But this also to say that because Lagos State, for example, there's a Lagos State Blood Transfusion Service that also regulates blood donor clinics all around, and they continue to ensure that they're able to detect these people that do these sharp practices. So unfortunately, some people do that, which is very much frowned at. But largely in accredited and government and properly run hospitals, blood are not sold. They are only asked that they pay for the screening, of the blood, because some of the screening tests are quite expensive, and many of these facilities cannot bear the cost, even for you that are coming to donate, freely. So that's what the payment is for, not for the blood itself.
Thank you. I believe you heard the payment is for the screening of the blood, not for the blood. However, some hospitals carry out this bad. Some hospitals, I think it's high time that if you notice any hospital that does this, maybe you try to report them so that it can encourage other people to come out and donate. The more people that we have as blood donors, um, we can save more lives out there. Hmm? Yes. There's a comment that says some will send you to go and buy blood, then you go to another hospital and buy it, then still pay for everything. Yes, Oluchi. So let me put this comment here. Some will send you to go and buy the blood, then you go to an hospital and buy, and then you pay for everything. Some, like you heard what Dr. Yusuf has said, they do that, but it's not encouraged. So if you want to donate blood, go to government accredited centers. Now, if you have questions, please start dropping them. Dr. Israel will be taking your questions. We'll read your questions out. I have one more question, sir, and that is on the place of tattoo. We've been told previously that if you have tattoo, you might not be able to donate blood. But right now, I have seen in different places people say that no, if you have tattoo, you can still donate. So, as an expert, please, what is the current teaching? What is the current guideline on tattoo and blood donation? Thank you, sir.
Okay, so there is a clear guideline. I will first say the clear guideline to directly answer, then I'll now give the explanation afterwards. So you can donate if you had a tattoo. If I let me extend it a bit, you can also donate blood if you have even have some piercing, in your body, whether in the ear or in the nose or anything. Now, but the only thing there is that you can only get to donate. Say, for example, if you had a tattoo put in today, you have to wait for a year, before you can donate. And then I would explain why. So you can donate if you have tattoo or even if you have piercing or other things. But the current guideline here in Nigeria and in most parts of the world is that you can only donate after 1 year in which you've had that tattoo. And the explanation to that is this: because particularly in the past, now it's even done more hygienically and safely. Sometimes in the past, people that go to shops where tattoos are done and everything. So they used to share the without sterilizing the instrument that I used to actually apply the tattoo or to do the piercing. But for that practice has changed now. But the fact that it's still an invasive procedure in which during the process of either having a piercing or a tattoo, some blood would come out from the individual having the tattoo on, which could stay on particular device that is being used to put the tattoo, on the skin. And because we know that there are some blood transmissible infections, like HIV infection, hepatitis, infection, and the like. And we know that these conditions, when they are present, particularly at the time of infection, may not be visible in the early phases. It may take a while for it to show up. And so if you do a screening for the person at that time, the individual at that time, it may not show up. And we don't want to have a blood product, a blood that has been donated, to be given to someone to save the person life, and in so doing now introduce or give the person an infection. So that's why this guideline or this rule is put down, that we don't want to discourage people that have had tattoo, but it's a personal decision for them, and we respect that. But in order to make the blood to be donated and then transfused later to be safe, we want to give that 1 year gap, so that when it's now being tested, you'll be allowed to donate, even without running any specific test really per se. But that blood unit, whenever it's tested before it's being given to the recipient, will be sure if there's any infection in it or not, just to ensure that the recipient is kept safe. So that's the reason for the rule. And to reiterate again, don't be discouraged if you have a tattoo, or if you have had a piercing, or any other form of similar procedure that you would have done. But you may need to wait for some time, just for the benefit of the recipient, because we want to be sure that the blood that you'll be donating, that there won't be any form of infection in it. It's just for safety reasons, basically.
For safety reasons. Thank you, sir. If you have questions now, please start dropping your questions, and share the live. Share, please share this live session. You're getting this free of charge. I want to ask one question, and everybody listening to me right now: have you donated blood before? Yes, if you have, tell us yes and when. If you haven't donated, tell us why. So there's a question here, sir. Let me go and get it. Dr. Israel, I don't know. Oh, your network. It says, can a PCV level of 40% or 38% donate blood? This is from Divine Destiny.
Yes, for sure. In fact, I would say it's even getting towards the high side. Like I said, hemoglobin of about 12.5, which equates to about 36% of PCV. So 38 and 40 is excellent, for, because in the male the PCV can be as high as 42 or 44%, and it's still considered normal. While in female maybe about 38, 40. So that's a very good blood level to donate, but I encourage the person to donate, regularly, because aside from keeping the blood level at a good level, all the health benefits like we mentioned, making the bone marrow healthier, less risk of infection. I didn't even add that before. The person feels much better in him or herself. It helps to maintain ideal body weight, and several other benefits, like mentioned before, just so that I don't repeat them again. But it's good to keep emphasizing is that there are a lot of benefits to donating blood. That's why you should donate voluntarily.
That's why you should donate voluntarily. I want to ask one question. I don't know why they are not asking. Later, they start sending me the question privately. Somebody went for normal check, and then he came out and said his blood level was very high. And so they told him, oh, one way to help you right now is for you to donate. So what I want to ask is, for those people who feel as if their blood pressure is excessively high, can blood donation also help them bring down their blood level, help them correct it? And what happens if this blood level remains high and he doesn't donate? What happens to him or her?
Yeah, it's okay. So like everything in life, so too much of something is also not good. So there is actually a blood condition whereby one can have excess amounts of blood. You know, So we give it a medical name. We call it polycythemia. Because at this point, when the blood is now too in excess, it becomes too thick. It doesn't flow in the body so well, particularly in the brain. So it can cause headache, can cause the eyes to become so red. It can also cause something. It can cause a number of symptoms really. So in this particular condition, when there's excess blood in the body, because that can happen, even though it's not so common, but it does happen. One of the treatment method of treatment modality is to remove some of the excess blood from the body, and in so doing, help to bring the blood level back to the normal range. Because if it's too high, it's not good, and of course, a low blood level too is also equally not good. So there has to be a balance, in everything. So usually, having them to donate regularly in order to bring the blood level that is excess to within normal is one way we use to treat, these individuals. And if this doesn't completely help resolve the issue, there are some medical treatments, medication that are given. Suffice to say that this blood that is in excess, for those that have excess level, I'm not talking of those that should donate blood that have normal blood level, they're healthy, they fulfill all the criteria to donate what they can use. I'm talking in this instance now for those that have excess blood, and then it's been shown that this blood level, it has a result of some blood abnormalities that made the level so high. So when they're asked to donate, is to help to treat them. The blood that they donate is usually not given to other people. It's usually discarded, because the blood that those people that have excess, those individuals that have excess amount of blood that is taken out from them to help them normalize their own blood level, is not so efficient in carrying regular oxygen in the body. So we don't give that to those that need blood. We only give blood from those that have normal blood level, that not in excess, that are healthy, and the blood has been screened and shown to be safe, for it. So this is a form of treatment for this set of individuals that have an excess amount of blood, and the blood is usually discarded because it is not going to help anyone that's going to receive it. But it's meant to help the individual that have an excess amount of blood, so the person can feel better and also feel relief from most of the symptoms it comes with.
Okay, it helps. Dr. Israel has a question. I don't know, Dr. Israel, um, if you can hear me. Dr. Israel, can you hear me? Yes.
Yes, I
Okay.
can hear you. Can you hear me?
Yes, yes. Go ahead. Go ahead, please.
Thank you so much, sir, for how you've been breaking down blood donation. So I want to quickly ask this question. How many mils or liters of blood can someone donate per time in compared to their blood volume? Because some persons, when you tell them to donate blood, one of their fear is that if they donate blood, their blood will finish. So because they think that in blood donation, you are going to collect all the blood in their system. So how many mils or liters of blood can someone donate per time with respect to their own blood volume?
Yeah, thank you, Dr. Eze. That's a very common question we have that people want to know. So thank you for asking, to bringing that up. Really, so at least the first thing I could say, if you say when you donate blood, your blood no go finish. Oh. That one make you make you just quickly first know that one. Because if you check your body, you get almost up to 5 liters of blood flowing in our body. That's almost like a cake of blood. So anytime you donate blood, so for those that have donated before, or that have seen someone receiving a blood transfusion, you would have seen the bag. That bag doesn't contain more than 350 mils, of blood in it. There's even a smaller bag that we give for children. That one is even much smaller than that. So if you look at it, you have about 5 liters of blood flowing through your body. What you are giving is less than 500 meals. Is about 50 meals, or even less, depending on how rapidly it flows. Or at times you don't allow the bag to get too full or too excess, so you can only donate just 1 unit per time. We don't encourage people to donate 2 units, at a stretch. Like the question I just answered about those that have excess blood. So when we want to remove excess blood from them, not to be given for transfusion, can take out more than one. And in those people, even after maybe taking 1 unit, we might give them, drip, or ask them to take a lot of water and then take another one. Because just taking one from them may not be enough because they have so much excess. But someone donating blood, will only take 1 unit at a go. We don't encourage having to take 2 units at an instance. And like I've answered previously, one is better or can donate every 3 to 4 months. That's every three to four times in a year. So the amount of blood that is taken, even though at that point in time it reduces the level, but it's rapidly replaced. And like I said, it even now makes the bone marrow where the blood is produced from more efficient. It now turns out more to replace that, and within a couple of days they are replenished. And every other thing is come back, and you now have fresher and even better, younger, healthier cells circulating through your body. So it is very, very, very beneficial to donate blood. The amount of blood that is removed is not one that will harm you in any way, because it's just a small fraction of it. Compared to the amount of blood that you have. And at that point in time, it's not going to have any negative impact on your health at all. If anything, it's all only going to make it even much, much better. Yes, for some people, they may feel a bit dizzy, and that's why we encourage to take water, before taking it, but before having the blood donation done, or even afterwards, because they are removing some amount of water from the body, not just even the blood. So you may feel a bit dehydrated, but many people don't even feel any differently after donating blood. And that is the reason why it's a particular weight limit is set. If one is underweight and one donates blood, one would have those symptoms coming up. But if one is of ideal weight after donating, you can even go along with your regular activities without even feeling that you've done anything. And in the next couple of hours, you would even be feeling much, much better in yourself. So it's just some amount of blood, not one that will harm you. If anything, is very beneficial to your body system.
Thank you, sir. So they are not going to take your blood and finish the blood you have in your body because people say you want to finish my blood. So you mentioned something about telling them to drink water, and this takes me to my next question. Can you help us? Okay, I think they are two together. First of all, is what should somebody know when trying or preparing to go for blood donation? What are those things you need to have at the back of his mind, especially for those who have never donated before, but they might be scared? So, what should he or she know? That's number one. Number two is that they tell people after donating blood, sometimes they give them malt, sometimes they give them milk. Now, because of that, this belief system that malt and milk would make you form blood, just help us chip that in. Is that true that taking milk and malt after blood donation helps? Why did they include that together with the first question, sir?
Okay, I hope you can still hear me.
Yes, yes, I can
From
hear
there,
you.
it's kind of. But I heard your question quite well. So the first thing is, so when you're going to donate blood, say for example you hear of a blood donation drive somewhere, and you want to go, or you just want to go maybe tomorrow, but you want to go to a blood donor clinic, either in Laswit, in Ikeja, or in Luton, in Deraba, or any other place you have identified where you can donate blood or walk in and donate blood. The first thing is, don't go to donate blood in a fasting state, meaning that you have not eaten, not drank water. So if it's the day you are fasting, that's not the day to go to donate blood. Ideally, you should have had a meal, and many times when you get there, they will not ask you if you have eaten. If you are not, maybe you are going in the morning, if you are not one that eats breakfast that early, you may just be asked to take something, to see, because at the time you donating, because some volume, some amount of blood is leaving your body system and the body water itself. So if you have not eaten, or if you don't have anything that would replenish that amount of water, or that will make your body conserve water, you may feel the blood donation much more. And so you don't go to try to donate blood in a fasting state. Ensure that you have had a meal and you have taken water. Now, the other aspect of after donating, now being given malt or milk, for it, because like I mentioned, for you want to replenish the volume of food. So I would say the malt and the milk thing is a Nigerian thing, trying to give something. Of course, one, you try to show some level of appreciation for those that donate, not because for them come for that purpose, but also we know that they need to replace the volume. By volume, I mean fluid. Instead of just taking ordinary water, maybe we want to take things that are also known to have some nutrients in them that can help the body. Say, for example, milk, for example, have some iron, it needs, of course, some protein so that the body needs, and some multivitamins. Then the malt drink that has barley, and some of them are also fortified with maybe some vitamins and all that. You just to start giving the body things that it will need to reproduce the blood. But really, this might not essentially be necessary, because if you eat normally and regularly a balanced diet, having donated blood, your body has, because our body stores iron that the body needs to produce the blood. It stores folic acid, vitamin B12, many of the ingredients or many of the things the body needs to produce blood. We already have them in our body system. So it's not the malt or the milk you drink immediately after that will help. Of course, if you can take anything additional that can help add some volume to your body system, so that as the blood recirculates, a new fresh one is being produced, you feel much better in yourself. So that is just what we had put in this part of the world to give to people, ask people do. But generally, really, even if it's just only water you are able to take after the donation, that will be just fine. But we encourage people to have had a meal and taking some water before transfusion, sorry, before donation, just to ensure that they are able to go through the process without feeling any form of dizziness or feeling not necessarily weak or tired. Particularly if you have ideal weight and you are donated a unit of blood, which is just of that volume, you shouldn't feel anything at all. Even after donating, you would feel almost instantly, your normal, usual self, and can continue with your daily activities immediately after donating.
Thank you. We have about 14 minutes more and then we're done for tonight. We have a question here. It says, please, doctor, is there any symptom that occurs in someone who have excess blood in the body? I think when you mentioned the polycythemia for those with excess blood, um, can they expect any symptoms that might give them sign to know that maybe they have excessive blood in the body?
Yes, okay, so good question. Even though I just mentioned that in answering one of the questions, but it's good to just brush on it really a bit. Yes, there are symptoms for those that have excess amount of blood, in there. One of the symptoms is headache, and we know headache can be caused by a whole lot of other things, so it's not so specific. Okay, but some other things that could be seen, because they can have headache, dizziness, but it's the redness of the eye. We know some people that have allergies so could have red eyes, so that may also not be specific, but that's one of the signs that you could see, with it. One of the other things is in the palms, it might become so red, and again, for some people, particularly fair-skinned people, you may actually have an increased redness, in here. So the symptoms are not so specific, really. But there are things, if one you have a constant headache, some redness or heaviness in the eye, and then dizziness also, because even though it's excess, it can, because the blood is flowing slowly in the brain because it's quite thick, and it can make one feel kind of a bit dizzy. But many a time this is usually detected by just going to the blood test for some other reason, and this will be detected in that instant. But when it's caused some symptoms, these are some of the symptoms that could arise: headache, dizziness, some fullness in the head and the eyes, and redness of the eyes and the palm, or even some abnormal sensation in the hand, for it. But many of these, like, they can also occur in several other conditions. And that's why it's important that when you have or you notice some symptoms in yourself and you can explain them and they are not abating after maybe taking some things to relieve pain. For example, maybe you take a painkiller for headache. It's always good to go to the doctor to have a proper check where things, other questions will be asked, and some basic tests that can be done. And this can now lead to the identification of this condition. So, yeah, those are some symptoms that can be associated with excess blood, but the other things can also cause that. So, the best thing to do if one experiences those things, or if one has that premonition that it's possible based on some of these things I mentioned, there may be excess blood. The best advice would be to go to the hospital to have one's blood checked, amongst other things, for sure.
Go to the hospital and get yourself checked. Sir, we have one question. Please, if you have question, drop now. We are almost rounding up. So there's a question here from Esther. It says, okay, what is the kilograms? It talks about the blood volume. What's the amount of blood that someone should have in the body? I think that's what you are asking, Esther. The amount, yes.
Yeah, I thought as much too. Yeah, so majorly we don't measure the volume because there's no way to really know the exact volume of blood, but we know an adult have about 5 liters of blood circulating in their body, really for it. So what we check to know if one can donate blood is the level of the blood. By level of the blood, we mean we are measuring the most important part, that what makes the blood appear red is what we call hemoglobin, and is the thing in the blood that carries oxygen. That's the most functional part of the blood, and because without that, all parts of our body will not be able to get what they need to function normally. So that is what we call hemoglobin. It measures the amount of that red redness in the blood. Let me put it that way, just for the sake of understanding. The level has to be at least about 12.5 grams per deciliter. So we usually measure it by just doing a simple blood test to check the level. At the point of donation, they can either use it's a machine that can check it instantaneously, it's a point of care test, or they can take a little amount of blood and run it later to check. Even in the past, one very easy and crude test to use is that they'll just put just a needle prick. A drop of blood is put into a particular type of special type of solution. If the blood sink down, you know that the blood level is adequate. If it floats, you know that the blood is not adequate. That used to be done in the past, but we no longer use that now. We use something that can give us an idea of the level of the blood at that instant. So once they check it and within seconds it brings the level out. If it's not above that 12.5, then you will not be allowed to donate because it won't be safe for you to donate blood if you don't have enough, yourself. But if you have an adequate number or level of blood within the right limits, not in excess also, you would be allowed to donate. And really, it's very much advisable for you to donate because it only makes your blood even better. So nobody donates blood and now the blood level keeps going lower. And that's why we put a limit to how many times you can donate. If you don't donate more than you should ordinarily, which is 3 to 4 times a year, your blood level will not go lower. If anything, it will even continue to remain optimal, and you have fresh blood at most times because those blood that you've donated have left your body system. They have to be removed placed by a bone marrow, which does the work very efficiently well. You now have healthy young cells.
Uh, okay. I guess my network here. Okay, we are almost out of time. Sir, there's a question here again from Tanganza. Person is looking for home remedy. I don't know. Okay. He says, if such symptoms are in place, okay, talking about the excess blood, what can somebody do to reduce the excess blood without donating?
Yeah, like I said, there are some medical treatment, but the first level of treatment or the first line of treatment is actually donation. In fact, that is been shown to be more effective. So there's no home treatment or home remedy, for that. But the thing is that for you to even know, so how would you even confirm or know for sure that you have excess blood? You need to go to the hospital. So it's not something you can treat at home, even if you suspect you have it. Because what if it's not the excess blood that's causing what you think it might be? So my best advice, for the person will be to go to the hospital, and blood donation is still what is, been shown up to date to be more effective. It's only when that is not enough that some other treatments are added, to the treatment of excess blood. But that's just to answer it briefly, since it's not the main topic we are discussing today. But please always seek, a medical, advice as opposed to a home remedy. That most times may not be the best way to go.
Yes, Thank you. If you are just watching or you're just joining, we've answered some questions before you came. Esther, your question has been answered before. You will have to go back and watch from the beginning. Asking why do they charge patients after donating? Dr. Adelabu has answered that before. So, sir, as we round up, there's this question I want to ask. Will there be a problem? Just help us break it down. Let's say somebody receives a blood that was not properly screened. What can happen? And then what happens too? Let's say somebody received the blood was properly screened, and the person develops a reaction. Can this happen? And if it does happen, what can be done for that person?
Okay, so excellent question. So the thing with blood transfusion is that when a particular individual requires blood, so it's been shown medically out, maybe this person was involved in a road traffic accident, lost blood, or the person is using from treatment, maybe treatment for cancer, and in order to be able to continue the treatment, in the transfusion, or there is a severe infection, the thing that broken down the blood level, or the woman is in labor or wants to go for a cesarean section and the blood level is not adequate or has lost a lot of blood. This so all the instances in which blood is required. So before a blood unit is given to a particular individual, it has to be, not only will it have been screened. So in Lagos State, for example, so all blood are screened centrally, and also has to come with a particular logo, a stamp on it of Lagos State Blood Transfusion Service, showing that this blood has been screened with the recommended screening test to see that it is safe of, hepatitis, HIV, those are the main syphilis, those are the things that are usually checked standardly, in all screening centers where blood is being issued to be given. For the individual to receive the blood, we have to see that the blood is compatible with it. So there's what we refer to as cross matching, because different people have different blood types, and there are some blood types that don't go with one another. You have to have the compatible blood type to be able to receive it, that would work in that individual. Okay, so these are some of the things that are usually done before transfusion even starts, and these are things that helps to prevent there from being a blood transfusion reaction. So a reaction is when you get the transfusion and then your body is not accepting it. You are beginning to have some things happening in your body as a result of the transfusion that you've had. So one of, even despite all of this, the possibility of transfer of some transfusion reaction is always there. The risk is not 100%. It's not zero. You cannot eliminate the risk completely, but the thing is, the risk can be very much reduced by ensuring that all the necessary steps are taken, right from screening of the blood, cross-matching it in the laboratory where it's going to be issued that, okay, person A needs blood. We want to give this unit B. Is the blood compatible? That will be checked. After it's checked and it's issued, and it's also now gotten to the individual that needs the blood, before the because in a particular hospital, for example, in a section of the hospital, there might be 4 people that needs to get blood, and maybe they brought the blood for the 4 people. You want to be sure that even after you have done everything right, you don't want to mix up the blood units, because if the blood that have been checked and screened for a particular person A, if it's given to B, inadvertently, that may cause a problem. So even at that point in time, it is checked. You have to check the person's name to what is on it to be sure that this is the right amount of blood. So there are some numbers and letters written there. All of these are just things to ensure that even before the transfusion starts, that everything has been done correctly according to the books to minimize that risk. But even despite doing all of this, in some instances, there's still a possibility, despite everything being correct, that the transfusion reaction can occur. And that's why before transfusion is started, we usually have some things in place because of that possibility. That's, because it's something that can happen. And then during the transfusion, there are some monitoring that are done, particularly in the first 15 minutes of transfusion, because that's where most of the reactions occur. So we have some things in place, some emergency drugs that in case a transfusion happens, we know what to do. So there is usually a protocol on ground that we are going to stop the transfusion, we are going to give this, we are going to give that. So all of these are to ensure that the transfusion is done, safely. But in case this does happen, which can happen, in terms of the reaction, that is treated. But in terms of making the blood safe, everything, if one is getting blood from the authorized or the proper sources, it's usually well screened, and the risk of having any form of infection is almost zero. So maybe because of our time, I'll stop here. There's more explanation to give
Yeah.
in this. It's really one. That's why one has to receive care in a hospital, that is accredited, and that don't involve in initial practices, and also that they are competent enough to do most of this medical intervention as required. Thank you.
Thank you, sir. We are so grateful. I know that you are a blood cancer advocate. You're really passionate about this together with your foundation. Let's say somebody wants to reach out to you, somebody wants to have a consultation with you. How can they contact you, sir?
Okay, well, I'm on all social media handles. In fact, for now, I'm not even, aside from lecturing at the College of Medicine, I'm not particularly affiliated to a particular hospital at this time. So I do a lot of consultancy service. So you can reach me, directly, or through, my foundation. Our contacts are all around social media. So I'm on, Twitter as Ask Him, and also um, on Instagram too as at Ask Him. That's ASKHAEM. So you can always, send a direct message, or can also contact the foundation at info@thewhitecellfoundation.com .ng. But like you mentioned, that's mainly for blood cancer related condition, because that's what the foundation is about. But for other blood related conditions, because I'm always available to be of any form of assistance that could render for any blood related condition at any point in time. So please feel free to reach out on Twitter or Instagram, and barely understood platforms.
Sir,
Maybe
I
not
think
today on
I think
Facebook.
this is spelling, right? Ask him. This is the spelling on the screen.
Yes, that's the spelling at asking.
And this is info@thewhitecellfoundation.com. This is correct.
.com.ng. Yeah, it's correct, but there's a
Okay.
.ng. It's .com.ng.
Okay, .com.ng. Okay, .com.ng. Okay, we got that. Thank you very much, sir. We are very, very grateful. We had Dr. Yusuf Adelabu, a consultant and a lecturer at the College of Medicine, University of Lagos, Nigeria, and he's talked to us about blood donation, blood transfusion, why you should donate, the benefit you stand to gain in case you are just joining us, and what you need to know. These are things you should take your time and watch. And please share the video. These videos are gold, not gossip. Not you go and do gossip finish and then you're looking for private chat. Please help us share this video and we appreciate you. Sir, any final words as we disappear tonight?
Yeah, the final one is that blood donation save lives. If you actually donate, even a unit of blood can be used to save three lives. That's something we didn't even get into today. So nowadays that blood donation not only has benefits for the person that will receive the blood you are donating, but for you, the donor. And it's always good to be a voluntary blood donor, because those that donate blood as commercial blood donors, which we don't advocate at all, because the gain of the financial gain that you have at that time would only be temporal. And many times those that are not motivated, to donate regularly, it's only when they're in need of something that they get to donate blood. So be a voluntary blood donor today, and remain healthy. Thank you. So we are muted, Dr. Friend.
Oh, yes, yes. Thank you, sir. Be a voluntary blood donor. Blood donation save life. You don't have to be a doctor, a nurse, a pharmacy to save life. You can save life with your blood. And like Dr. Yusuf has said, this commercial blood donation service is not encouraged. Don't sell. We are not encouraged to sell the blood. Go to any regulated center, government center, and donate your blood. Sir, thank you once again. We appreciate your time on the platform. Whenever we invite you, you always take out the time to join us. Thank you, thank you, thank you.
Yeah, it's my pleasure. Thank you for having me.
Thank you so much, sir. Um, Ladies and gentlemen, we are done for today, and I hope you gained a lot. Yes, so don't disturb me again about blood transfusion. Huh? Uh-huh. So if you know you are just coming, go and watch from the beginning. We spoke about the benefits. We spoke about the payments, why people pay for blood. Dr. Yusuf has said it before. Your payment is for the screening. However, some wicked centers still do this criminal practice of selling the blood, which is not right. So report them. You're not supposed to sell. The money they pay is to actually screen the blood so that we are sure that the blood is safe for you. But some other hospitals, you will donate, the person will still pay to screen, the person will still pay again on top of it, which is quite very, very bad. Is that okay? So I would encourage you to watch again from the beginning and share. Please. Support us. We're not asking for money. Support us, please, by sharing. Thank you. This program is every Sunday, 8 p.m. West African time, 8 p.m. on the dot. We start, and when it's 9, we draw the curtain. I appreciate you all. Like I always tell you on the program, good life now waiting, good life now sense. I'll see you next week. Take care of yourself and have a wonderful week ahead. Au revoir. Bye bye. Odabo. Kachifo. See you. Bye. Thank you, Dr. Yusuf. Thank you very much, sir. It was a very, very insightful session. Take care, guys. Bye bye.